so that we can, there we go. So officially being recorded. And we're going to record this and put it on MPHA's YouTube page for folks to view if they weren't able to make the live presentation. So for whatever reason, you're not okay with being on a recorded webinar, now is the time to jump off, but I hope you'll stay with us. So my name is Matt Wellington. I'm the new Associate Director with Maine Public Health Association, and I'm your moderator for today's webinar. And this is part of our monthly webinar series for MPHA. So a couple ground rules to note. So the basic agenda here is we have two amazing presenters who I'll introduce in just a minute. We are going to have presentations from them about the work we'll cover here, and then questions afterward, which I will facilitate. So if you have a question, please hold on to it until after our presenters are done speaking, and then just use the chat function. So type it in the chat. I will be reading those, and I'll relay those to our panelists. So that's the first thing. And now for our topic. So welcome to our webinar From Awareness to Action, Uncovering Tobacco Needs and Implementing Change in New Mainer Communities. And again, I'm really excited to have our two speakers with us. April Hughes is an Associate Program Manager at Healthy Communities of the Capital Area. So thank you so much, April, for joining us. And Emily Dooling Hamilton is Health Promotion Manager at Healthy Androscoggin. So without further ado, let me pass it to April, who I think is going to kick off our presentations. And again, my name is Matt, and my pronouns are he and him, by the way. So April, I'll pass it to you to get us started.
Awesome. Thank you, Matt. Thank you for that introduction. So just a brief overview of who we are, and I'm going to have Emily come on here in just a second. But at Healthy Communities of the Capital Area, we are a nonprofit public health organization serving Kennebec County. Some of our main interests of focus are tobacco prevention, substance use prevention, healthy eating and active living, food systems work, and we do have a variety of health equity and special projects, which one of our tobacco prevention coordinators, Adeline Deering, leads here at HECA. Emily, do you want to do a little thing on healthy?
Good afternoon. Thanks so much for joining us today on this beautiful, not rainy, yay, Thursday. Is it raining? Yeah, it's not raining where I am anyways, especially with my background, especially not, but no, in real life too. So Emily Dooling Hamilton, I work over at Healthy Androscoggin. We serve all of Androscoggin County. We're located in right downtown Lewiston. We're right by Mother India, a lovely Indian restaurant, and across the street from Boba, which is another wonderful restaurant. So if you're ever in Lewiston, come on by and see us. We're on the second floor. And we're a comprehensive community health coalition, and we have 5 main goals. We support tobacco-free lifestyles, we prevent substance misuse, we support physical activity communities, promote healthy eating, and prevent childhood lead poisoning. And we're under the fiscal agency of Central Maine Healthcare. I'll turn it back over. You'll hear from me again in a little bit, but I'll turn it over to April.
Yeah, and I should probably mention, just remember that we are located in Gardner on Mechanic Street, which is on the back side of Main Street. We're always tough to find. We're a small but mighty agency. And our fiscal agent is Medical Care Development. So thank you for that reminder, Emily. All right, so what we're going to cover are some overview and findings from the 2022 Capital Area New Mainers Project Tobacco Needs Assessment. I am going to start off with some backgrounds of this because there were other tobacco needs assessments that were completed by other organizations. And then I'm going to move into some of the tobacco prevention and treatment recommendations that were developed as part of that tobacco needs assessment. And then I will toss it over to Emily, who will cover tobacco prevention implementation with the new Mainer population in the Lewiston-Auburn area. And then, of course, we'll round it out with some Q&A. So a little bit of the background. I'm not going to read off some of the questions located on here that we were answering as part of the assessment, but in the fall of 2021, CTI did put out an RFP for organizations, and 4 organizations that have signed up for it were AK Health and Human Services, HCCA, MERS, and Portland Public Health. And what we were looking to do is kind of look into some of the cultural contexts of tobacco use and New Mainer communities. All right. So a little bit of the background on the Capital Area New Mainers project. Oh, what happened there? Hold on. All right, sorry about that glitch. It was probably an error on my end. So one of our main partners on that project was the Capital Area New Mainers project, which really utilizes a strong network of volunteers and community outreach workers. And one of the main things that they do are finding opportunities to connect the new Mainer or immigrant population in the Central Maine area, which is primarily located in Augusta, to different available resources. They also have some, they provide education around some of the immigration issues as well. Capital Area New Mainers project also hosts a series of community events. That way the New Mainer population here at camp can not only get connected to the community, but other individuals who may be interested in volunteering. I would say that camp was probably they were the most essential part of HUCA's tobacco needs assessment that was completed. In particular, Nika Nasir, who's the community outreach worker, really helped lead essentially all of the work that I'm about to go over as part of the tobacco needs assessment. And I will at some point hopefully link the camp's website on here as well. So a little bit of the community background. So as mind you, the numbers I'm about to present are, they were at the time of the tobacco needs assessment, which was conducted between January of 2022 to April of 2022. This is a snapshot of that. Since the tobacco needs assessment completion, I will say that the refugee population has grown considerably in the area of Augusta. So just very briefly, there were about, at the time of the assessment, there were about 413 refugees, primarily in the Augusta area, though there were some in Skowhegan, Hallowell, and Gardner, and then a few families located in the Waterville area as well. The population that was included in this needs assessment were primarily from Iraq, Syria, Afghanistan, and Morocco, although the focus groups, which I'll go over very briefly in a little bit, the participants were primarily Iraq and Syria. The camp immigrants do have often have very large families, multi-generational families, that they're all together. And then finally, a majority of the camp families are Muslim. And I do have a quote I want to share by Chris Myers, who is the executive director of the Capital Area New Mainers project. He did share while we were working on this that they are resilient and resourceful people who have overcome significant adversity, and they bring strong cultural faith and culinary traditions that enrich our shared community. They also arrive with significant needs, particularly for employment, housing, language, transportation, and healthcare. So that provided a lot of context originally when we first started the tobacco needs assessment. So a few of those different areas that we looked at when assessing tobacco needs within the community was around education, immigration, and healthcare. So as of 2022, there were approximately 111 foreign-born students enrolled in the Augusta School Department. There was one Farrington Elementary School that has an English language learners program where a lot of the new Mainer families, when they do come over, will enroll their students in the ELL program at Farrington. In addition, they also have the Augusta Multicultural Center, which is where camp is housed, that offers both Arabic and English classes for the new Mainer population, although occasionally they do expand it so that those and people in the community could also learn Arabic as well. Since we completed this assessment, camp did open up a second multicultural center located right in Hallowell, which is where they host their international kids festivals, which is happening during Hallowell Old Days. I might be saying that as a Hallowell Old Days, which I believe is coming up. If it's
This
not already
weekend.
occurred. This weekend. Okay.
Old Hallowell
Thank
Days.
you.
Yep.
I was like, I know it's coming up. Yeah. So during Old Hallowell Days, they do host the International Kids Festival, and they do encourage community members to attend that. So for immigration, a lot of the families that we have spoken to as part of the focus groups or in collaboration with camp, a lot of them shared that they did, when they first arrived over into the United States, that they spent a lot of time in either 1 to 4 other states before moving and relocating to Maine. Healthcare, which continues to be a major issue within the community itself. It does provide some challenges for a lot of our refugees and immigrants. And a lot of that is because many of the individuals or families that are arriving have experienced trauma and loss. They have often had physical and psychological ailments that demand significant medical attention, but it can be challenging at times for them to connect to the appropriate medical services within the area, due to a few other reasons, which I'll get into from our focus groups. There are a few healthcare facilities that a lot of the families will utilize here in Central Maine. That is Maine General and Family Medicine Institute. When we conducted the tobacco needs assessment, we did work with a couple of providers from FMI on this project as well to help aid in the focus groups and survey development. A little snapshot of the community that we gathered with Nakan Nasir, the outreach worker at camp, is there are a couple of marketplaces owned by some of the families here in camp, such as Mainly Groceries and Al Naim Market. There's also a mosque, or the Islamic Society of Greater Augusta. The English language classes, I mentioned the Augusta Multicultural Center, and I did remember to include the new Hollowell Multicultural Center in this project as well. They were in current renovations on that while we were doing this piece. The halal markets located in Augusta, which are on here just mentioned, the shop owners for these did play a considerably large role as a community influencer on this project. All right. A little bit of the background on the focus groups and surveys. So the camp outreach worker really led a lot of the recruitment and translation for the focus groups. Once again, that was Nakan Nasir. We did offer some recruitment incentives to families. We were offering $35 gift cards to one of the 2 local halal markets for participation in the focus groups. We did hold the focus groups. 2 of them were on the weekend on a Saturday, and 1 was during the weekday to accommodate everyone's schedules. In total, there were 3 focus groups with 37 participants, a majority of which were men, and then 15 women. There was quite an age range of the participants, between 21 to 65 years of age. And as I mentioned earlier, the participants were primarily from Iraq and Syria. Arabic was the primary language of the participants who joined the focus groups. It was somewhat challenging. Joanne Joy, who was our senior program manager, she has since retired, but led a lot of the focus groups in collaboration with NACA. And it could be challenging when they were hosting this, when you're asking questions in translation, sometimes the translation doesn't always translate well. So they spent a good amount of time recording everything that they were saying and writing it down as well. The surveys reflected a lot of the questions that we asked in the focus groups. And once again, were translated by Nakan Nasir. She created both an Arabic and English version of the Google survey and then sent it out to their camp families. Most of it was done through text message. So one of the things that we did learn about the community is that one of the best ways to share information for camp families is through text message. We later found out that that's difficult to kind of get some of the survey questions back because the answers weren't aligning well with the surveys. We did receive 18 survey responses. Once again, the age range was between 21 and 65. The respondents were from Iraq, Syria, Morocco. Some stated the other column, but didn't provide a location. All right. So some of the common themes that emerged from both the focus groups and the surveys were around camp youth tobacco use, environmental smoke exposure, such as secondhand smoke, camp adult use with tobacco, and interest in tobacco treatment, community influencers, and then different ideas for prevention. So what we found with the camp youth tobacco use was that, at least for the focus groups, that a majority of the participants did not believe that camp youth were using tobacco products. However, when we did have up pictures of different types of tobacco products, they were not familiar with vape devices at that time, so could not really say whether or not they have seen youth use vape products. However, which was completely different from the focus groups, but the survey responses that we received were that the respondents believed that a majority of camp youth use, oh my gosh, this is where I'm going to do all those tongue twisters, that the camp youth were using vape devices, but it was happening in other locations other than their home. So that they noted it could be happening at a friend's house or maybe a different relative's, but it was not happening at home. But they did believe that it was happening. They also believed that half of the youth were also using hookah or shisha. So originally when we wrote out the survey questions, we had been using hookah, but Nicole had translated over to shisha. So that part was slightly different than what we had in the focus groups. And they did believe that they were using that as well. In environmental smoke exposure, both the focus group and survey respondents believed or said that there was secondhand smoke happening in the house, not necessarily with cigarettes, but with hookah. And this was primarily happening more often like with men than women, but some of the women in the focus groups did say that they tried to remind their husbands to use it outside because they didn't want it around children. For camp, interestingly enough, there was a lot of discussion around the tobacco treatment side of tobacco use with camp adults. There was a huge interest in tobacco treatment. Many asked about which products or modes of tobacco use were more harmful than others. There's a lot of curiosity around that. And then more than one of the participants had talked about, had questions around quit attempts, weight gain associated with tobacco use or quitting tobacco, trying the patch, the different types of nicotine replacement therapy. And then also they had a lot of questions around what is currently available for tobacco treatment in the area. So we did discuss, Maine General or the Maine Quit link as different modes for tobacco treatment. But there was a lot of discussion around translation and being able to use an interpreter when utilizing different tobacco treatment services. For the survey respondents, a majority of them mentioned that if they did mention e-cigarettes as another form to quit using tobacco as well. So and actually both focus group and survey, there was a lot of questions around that piece. But also with the surveys that came up, not necessarily with the focus groups, was that in looking at the different ways or different tobacco treatment options, a majority of them mentioned that the way that they would be interested in quitting is relying entirely on yourself rather than services. So that was pretty insightful for us as we were working through this. One of the questions that we had talked about, especially in regards to camp adult use, that might be of interest, is that when we talked about where tobacco use was happening, whether it was in their home country or over here in Maine, they did say that there was increased use of tobacco products here as opposed to the home country due to a few different reasons. They mentioned unemployment, boredom, stress of transition to a new culture, not being as engaged in other activities, largely due to a lack of English language, both spoken and read. So that was a barrier. Community influencers, the men, especially in the focus groups, identified relying on themselves, talking with their wives, talking with their friends, and seeking support from their children for information related to tobacco treatment. And a lot of that comes down to asking their children to either because like I said, the language barrier piece is difficult, to translate available options for them in the community. The leaders of the mosque were also mentioned by focus group attendees, with one of the halal market owners being a important community influencer. The women reported that their daughters were very important in translating information and also sorting out cultural differences, and also asking them for support in decision making. And for our survey respondents, a majority of them said that camp youth would trust their parents to give them good advice or to share information regarding tobacco. Teachers at the kids' schools were mentioned as a possible community influencers for their young people, but primarily it was the adults in the group that were a community influence. So our ideas for prevention, I'm going to go to our next slide with that one to kind of talk about some of the recommendations that we formed. And just a quick note on these, that the recommendations were informed by the Tobacco and Prevention and Control Best Practices, Maine's existing resources like Breathe Easy Maine, My Life, My Quit, the Maine Quit Link, as well as the Maine Center for Tobacco Independence, as well as our focus group findings and assistance with the camp director and community outreach worker. So just quick thing, after I'm done presenting, I will post a link to our tobacco needs assessment. So everything that I'm sharing right here is located right in that tobacco needs assessment. So if you were curious about the recommendations or looking to get into some more of the details of the focus groups and surveys and the responses, they are all located right in there. So a few of the things that came out was that materials that are provided to camp youth and adults should contain both English and Arabic, preferably on the same page, because one of the original beliefs that we have is that if we were going to print out a flyer or a rack card, that the front side would be English, the back side of it would be Arabic. But camp had suggested that we put it both on the same page because a lot of the families, especially where if they are trying to learn English, learn better if they're written near each other rather than having to flip back and forth for a comparison. That if there are new and emerging tobacco products such as vape devices, that we should include a lot of descriptors, pictures, if possible, because they want to be able to see them. And that if, for example, at their kids' school, if their child is receiving information on vaping, that something be sent home to the parents as well so that they can learn and recognize these things together. Materials should be brief. If we had just one snapshot, one topic, that it be eye-catching and colorful. They don't want a bunch of information put on a fact sheet and then sent home. And that if we are going to do tobacco prevention in the community, that we make sure that we are engaging important community messengers, such as parents, if we're trying to connect with the young people, the ELL teachers at the Augusta School District or wherever, whatever community you're calling in from, as well as engaging at the multicultural centers and other community events to share this information. And to 100%, you have to work and collaborate directly with trusted community partners if you're working with the New Mainer population. So for us here in the Central Maine area, it would be the Capillary New Mainers Project. And we really should focus more on sharing information on secondhand smoke. Like we had discovered during the focus groups and surveys, there is a disconnect or not a strong understanding of the impact of secondhand smoke. A lot of people know that it's bad, but at what extent? And then switching the language a little bit, especially with tobacco products with the community, making sure that we're mentioning hookah, especially when we're sharing information on tobacco. And then we do need to develop community-specific tobacco treatment. There is a very strong interest in tobacco treatment, but like I said, there are a lot of barriers for the community to actually access and use what's currently available. So we just have to make sure that we tailor some of the programs. And one thing that did come up with camp is possibly having an Arabic speaking community worker who is also certified as a tobacco treatment specialist to directly engage with the community in person here in the Central Maine area. And I think that is it for me, Emily. Hopefully you don't have any
Okay.
tech issues like I
No,
did.
fingers. How we looking? Thumbs up. Again, Emily Dooling Hamilton over at Healthy Androscoggin. We know, there's disparities in tobacco use that really persist across socially defined groups, resulting in health outcomes that marginalized populations. Among these vulnerable populations are immigrant, refugee, and asylee individuals. In Lewiston, we have the second largest metropolitan area in the state, and 1/6 of the population identifies with African refugee or asylum seeker status. And a fraction of this population is widely referred to as New Mainers and has really continued to grow since the early 2000s. Maine really lacks comprehensive knowledge and standardized systems to deliver appropriate immigrant and refugee health services. And April just did a great job kind of talking about that process of gathering, this information. And I know I can't speak for, but AK Social Services, which is a social service agency here in Lewiston, did health needs assessment around tobacco in our area, kind of alongside with April. And from that, the kind of take home message was we need culturally competent or culturally focused tobacco interventions. And it worked swimmingly because we applied for a grant. Healthy Androscoggin applied for a grant through the Maine Cancer Foundation, and it allowed us to really build capacity with an ECBO, so an ethnic-based community education organization, Maine Community Integration, or MCI, to really create and implement culturally appropriate tobacco interventions when working with New Mainers. And so my thought for today is a little bit of background, but kind of talking about the process of which, through again this Maine Cancer Foundation, this wonderful grant that we have this opportunity with, kind of the process of, and then the intervention, we have finalized that and what that looks like, and then kind of our next step. So that's my hope for the next 20 or so minutes to really talk about. But again, through this Maine Cancer Foundation grant, we were able to work with the ECBO, MCI, Maine. It's going to be like alphabet soup here, Maine Community Integration, and their wonderful executive director, Faucia Musi, and my wonderful program coordinator, Rowan McFadden, also is a large part of this process. And we were able to go in with their help, right? They helped us recruit individuals. They helped us recruit the New Mainers to get in. And we kind of did two different groups. We did adult-facing tobacco interventions and youth-facing tobacco interventions. And you'll see myself here presenting, right? And we kind of came in with a bunch of information. We came in, we talked about what their tobacco knowledge is, what their perceptions are, experiences, tobacco messaging, suggestions for resources and training, kind of talking. We gave them a bunch, and we kind of were able to, and then with that bunch, we were able to kind of drill down what they, wanted, needed, again, kind of that evidence-based information that April talked about, and really emphasizing that multilingual, the modal resources, and really suggesting the next step is, so with that, we've been able to create, we call it a neighbor to neighbor kind of peer model education. And I'll talk more about that today, but from these wonderful focus groups, we did some with adults, we did some with youth, and that allowed us, again, with the funding and the grant through the Maine Cancer Foundation, to really to really help this process move along, and to create these culturally interventions, tobacco interventions. And so this, my thought for a little bit of our time is just kind of to go over what this looks like, right? Like what is the adult facing, what is the youth facing a tobacco intervention look like? And we were able, with the focus group's help, to really drill down it's actually 4 pieces. There's 3 on this slide, but the 4th, so we talk about tobacco, what it is, what it looks like, what does vaping look like, what's going on with our youth, because adult facing, a lot of folks, whether they're caregivers or their parents themselves, they interact with youth. And then the last piece is that cessation, prevention and cessation to tobacco, with tobacco. So thinking of our new Mainers, like, what is tobacco? What does it look like? What does it smell like? Kind of very basic information that is very important, right? Because it might not look different in it might look very different in their country of origin that it looks like here in the United States, here in Lewiston and Auburn. So what is tobacco? Thinking too, okay, tobacco, an offshoot of tobacco, vaping, e-cigarettes. What are they, how do they work? What do they look like? Next slide, what do they smell like, right? Especially if they're a parent or caregiver. Geez, I went into my kid's room and all of a sudden it smells like peaches. What's going on there? Really kind of talking about that and what that can look like. The next slide goes over, hey, not only did they have a different sense, they look like a USB port. They look like a highlighter. Where on this slide is a vaping device as part of that presentation. Where are they getting them from? Where are youth, if it's 21 or older, where are they where are they getting these devices in the state? Where are they getting them if they have to be 21 years or older to purchase these? We talk about that as part of the presentation and part of the intervention. The health effects, right? It's not just harmless water vapor. I really like this one because it can not only cover vaping and tobacco, but it can cover other substances, right? So, what are behavioral signs around youth that might be vaping? Thing two might be misusing alcohol, misusing prescription medication. Are they breaking rules? Do they maybe have a negative attitude or decrease in disrespectful behavior? Are they secretive behavior? You go into their room and they quickly are sliding something into their pocket. Again, that kind of scent thing, we really emphasize that. Maybe a decrease of quality of schoolwork. And also with the lens of, hey, these are teenagers, so maybe this could just be them kind of being a teenager as well. It's really hard to differentiate sometimes. And so it's just a nice, whether it's a refresher or new information for these adults and caregivers. And then two, what's going on if and when a youth has nicotine in their body and it quickly, we know that quickly nicotine, the half-life of nicotine quickly leaves our body. So they're going through withdrawals. What can that look like? They be depressed mood, they have headaches, they're irritable, trouble sleeping. So again, just having that information for them. Thinking about nicotine in the brain, right? Our brain is fully developed around the age of 25. So when these products are introduced, youth can become very addicted very quickly. It can really change their brain, right? So kind of going over that information. Resources for a youth to quit. We go over that as part of the intervention. The laws around, how old do you have to be to purchase? You can't use tobacco when I'm at Healthy Androscoggin or at the movie theater. When I'm in Lewiston Public Schools, no one should be vaping. We kind of provide that information as well. Again, the health effects, the dangers of tobacco is covered as part of this intervention. Unintended injuries, so thinking of littles, right? Like little pets, toddlers, unfortunately there can be poisonings if left out. They're flashy, they look colorful. A toddler might not know, so kind of safely storing those. Unfortunately, they're battery operated as well. They can explode. So again, providing this information to adults. April brought up as well, that secondhand smoke. What is secondhand smoke? What do we know about it? So really part of that presentation, going over that. We know, that a lot of new Mainers use hookah, and it's almost part of a celebration when there's a new baby, and it's very social as well. So they may get together and use a hookah to celebrate a marriage, to celebrate a birth of a child. And so thinking of that secondhand smoke of the hookah, and then thinking also of the secondhand smoke I'm sorry, not secondhand smoke, but thirdhand smoke when that is happening. So kind of educating around, hey, if and when you're celebrating, take the hookah outside or not use the hookah at all, or really be aware of, the holding a baby against if you have just used tobacco, against your clothing as well. So we cover that. I really like this one because there's there's a stigma around, I'm tripping on my words because there is a stigma around, hey, they're Muslim, so they don't vape, they don't use tobacco, they don't misuse medications. And that's just the unfortunate thing, that's not the case, right? Whether it's, okay, kind of April mentioned, they may not be using these products in your home, but they may be exposed to them outside of your home, right? And so I think talking about with adults and caregivers, your rules, your home, your rules. So no misusing products at your home, but then also that translates out into the community as right. So also knowing what your child, what your niece, nephew is doing outside of your home as well is just so important, not only for vaping, but all substances. And we'd be remiss not to mention cannabis, right? Whether it's, hey, the youth can turn these devices and vape THC, or hey, this is what it smells like. Very basic information is just so important as part of this presentation, as part of this intervention. And then the last piece for the adult facing is really taking a look at prevention, tobacco prevention, and then cessation supports. So if they know someone that's interested in quitting, how can they support others in quitting? What can they do? What can they say? And so we kind of go over that, almost a brief tobacco intervention and how to do that. And then also we really emphasize and talk about the Maine Quit link and what that looks like, what that provides. And then also thinking of too, hey, English isn't their first language. What can go on around translation services, and taking a look at the website, can be translated, for different opportunities and options for translation services. So again, this is for the adult facing tobacco intervention. Probably around 45 minutes or so, maybe a little bit longer. When we held it for the second time, we kind of did a focus group. We came back with their feedback and presented this kind of finalized presentation. And there was also an interpreter there. So again, if you're conducting these opportunities, think about that as well. That just kind of is a different, or not different, but it's just an added variable for length of time, right, as part of a presentation. So that was adult. The next one is youth. So the youth facing. So again, adult facing and then youth facing tobacco intervention, 45 minutes, no way too long for a youth to whether, sit through, whether to also share with. And again, the thought is, and I'll talk about this at the end as well, but with these interventions, we've really found the greatest way to spread this message, to spread this information, is coming from their community. And April kind of mentioned that. So we've created this again with the help of Maine Cancer Foundation, and now we're going to work with Maine Community Integration, MCI, the local agency in Lewiston, to really help us get this message out, to get these interventions out. And so, and I'll talk about this more, but this is again the youth facing. So not 45 minutes. I would say this is probably like 20 minutes. Here we go. Quick, to the point. And again, we utilized a focus group with youth that really helped us drive and create this intervention. But first question, and thinking of too, not text heavy, right? Very picture heavy, not a lot of text on these presentations, especially the youth one. What do they already know about tobacco? What do you think the difference between tobacco and vape is? Really kind of getting their brain waves going, right? Asking them, hearing from them is just so important. And then providing them a little bit information about nicotine in the brain, you know, how it can interfere with your memory, with their attention. It can cause mental health issues such as depression, how it can really affect the development of the prefrontal cortex in their brain. You know, how addiction can really happen much faster in a brain that's or it hasn't fully developed. Again, just providing that information that they may or may not know is important. The harmful effects as well for the youth. And this is it kind of just lets them think about it like, hey, propylene glycol is found in a vape. It's also found in antifreeze. Like, oh, acetone found in a vape, also nail polish remover. So kind of wrapping their heads around like, hey, actually not very safe, right? Not as safe as we maybe think it is, or it's been target or marketed to us. So again, I just kind of wrapping their heads around this information. And then the next one, you know, how to have helping conversations, right? How can they help someone, maybe a friend that's interested in vaping, or they themselves are interested in vaping? How do they have that helping conversation to someone who might be struggling with tobacco use? And how can we you know, what helps them feel empowered? How can they carry this information? How can they carry this empowerment into their community when working with youth is also another part of this intervention. And then lastly, kind of that tobacco cessation specific for youth. My Life, My Quit is specific 13 to 18 years old, a great free resource if and when a youth is interested in quitting. So providing that to the youth as well. Again, the youth tobacco intervention, I would say is around 20, 25 minutes, very quick, very brief. And so we've kind of figured out the two tobacco interventions, one adult facing, one youth facing. Our next step, again, this is a 2-year grant with Maine Cancer Foundation. The year 2 is really getting this information out, right? We have the interventions. And so we've figured out that, again, kind of, I previously talked about that neighbor to neighbor concept. We know that our community members are very social, and it's a very verbal opportunity for folks. And so we've figured out, hey, let's create flip books. So those slides that you just saw, we're going to create those into flip books. We are then going to, with the help of Maine Community Integration, MCI, we are going to work with them, and they're going to help us recruit tobacco ambassadors. So we're going to recruit 2 tobacco ambassadors that are male, 2 tobacco ambassadors that are female, 2 tobacco ambassadors that are youth. And between MCI and Healthy Androscoggin, we're going to train those tobacco ambassadors on what we just covered. They're going to be provided a script to kind of help them to go through the presentation. And whether the script is in English, the script is in Arabic, it's in French, you know, we're able, again, with the funding through Maine Cancer Foundation to translate those materials and then print those flip books. And then we ask those tobacco ambassadors to go out into the community and work with community members, providing this training. And we really hope that this will be a great way to kind of get this information out. And we, again, with those, and I think I'm going to wrap up by saying, again, I really think that this work, A, is so important, but B, we need to honor folks' work, right? So when we work with Maine Community Integration, when we work with Faucia and her staff over at MCI, you know, to honor them, to pay them, right? Like we have funding, again, through the Maine Cancer Foundation to provide a stipend to them. And then the folks, thinking of all those focus groups that we held, there was a small incentive involved with those as well. When the tobacco ambassadors will have a small incentive. When they go out into the community, there will be a small incentive for those 5 that they work with when receiving that information. So that's really a nice take home, and really just so important as part of this work. I'm trying to think if there's anything else that before we get to questions. So again, we're kind of we just wrapped up year 2. We're moving into year 3 and kind of getting this information out. We also hope that not only with the tobacco ambassadors getting this information out, kind of meeting people where they're at. So we go to a local mosque and provide this training. We work with AK social services and train, their staff on having these this information disseminated, this tobacco intervention disseminated. So more to come, but thank you so much for your time today. And I will turn it back over to Matt for questions. And I think we have some time. And April, if you wanted to add anything.
No, I just I guess I would say that I did pop in a link to the other 3 tobacco needs assessments completed by AK Health and Social Services, Maine Immigrant and Refugee Services, and Portland Public Health into chat box.
Awesome. Thank you both. That was really amazing and really interesting to hear about. So I've got a couple questions of my own, but I'll hold off on those until other folks ask their questions. So again, for people who want to ask questions, just type them into the chat and I'll relay them to the speakers here. So had a couple questions. April, thank you for answering one of those. Emily, someone asked, do you go over the cannabis laws regarding it being illegal if folks aren't citizens yet?
Great point, Leanne. Yes, we do. That is so important. And there's a great resource, and Leanne, I know that you know it, but is it the legal resource there's a great cannabis resource of like, hey, don't even wear a t-shirt with a cannabis leaf on it. Don't work at dispensaries, or like that can really impede your ability to become a U.S. citizen. So absolutely, that is so important, and we do talk about that as part of the presentation.
Awesome. And a quick follow-up from Leanne on another question around nicotine replacement therapy for youth. So they can get NRT if they have a doctor's prescription, if they're under 18. Do you include that as well in your presentations, that they can access those resources?
Great point. I know that I'm thinking of My Life, My Quit, and I know that they do not administer like nicotine replacement therapy like the Maine Quit link does. But yes, great point. And that's a great point of talking about, if they are interested in, they can speak with their doctor or their primary care provider, or their, maybe they have a school-based health center as well, and talking with those individuals on getting nicotine replacement therapy. Great point, Leanne.
Awesome. So if other folks have questions, pop them in the chat. Before we get other questions, I'll just ask one of my own. So Emily, you mentioned hookah and shisha being part of cultural events, cultural celebrations. I imagine that makes it really difficult to address that. You talked a little bit about it. Can you say more about how you're navigating that in your discussions with people, in your messaging, in your material specific to hookah? Because it's certainly come up a couple of times in my own work related to tobacco across Maine. So curious what you have to say in April as well.
We're really lucky, again, working with MCI, the Maine Community Integration, and Faucia Musi, who's the executive director there, previously worked at Help the Androscoggin, and she has brought this up to our attention. She also was very educated in that information, right? So we actually not paused, but we took a significant amount of time as part of our presentation, Matt, on hookah use and third-hand smoke, secondhand smoke, to really be able to administer that, disseminate that information. So it is, you're right, it is so important, because it's some of which is built into their culture, right? It's culturally part of their celebration and celebrating. So, hey, how can we still celebrate, but whether it's not use hookah, or use hookah outside, or change your clothes after, before you hold the newborn baby that you're celebrating as part of this celebration. So again, there is a conversation to be had, and we hope, with those scripts, that we can include that information as part of those flip books, as the tobacco ambassadors are trained in getting that information out.
Thanks, Emily.
Yeah.
April, can you chime in on that too?
Yeah, I was going to add, when we conducted the focus groups, there was, because mind you, part of the tobacco assessments is really looking at assessing the cultural context of tobacco within the New Mainer population. And in the focus groups, there was that conversation around secondhand smoke exposure. And one of the things that came up, why was hookah or shisha being used indoors? And there was that cultural context and celebrations. We had members that were part of the focus group state that if they had friends or family visiting, even just playing a round of cards, that was something that they would use together and community with one another. So one of our follow-up conversations, as a team after we had conducted the assessment was that we have these recommendations, and if we are moving some of these recommendations forward, what is some of the language that we need to consider as tobacco prevention professionals working on creating materials for education with the specific population? Like what is one of the things that we need to tackle? And the first thing that came up, especially in regards to secondhand smoke exposure, was providing more education on hookah and shisha, and what are the secondhand smoke impacts from that on family or friends that are potentially be exposed to that while they're indoors. So even though we had conducted the assessment, it is something that we're considering once we move forward with implementing some of the recommendations on our end with that. But yeah, there is definitely a need for some more education on that piece.
Right.
Yeah.
Again, folks, if you have questions, put them in the chat. I wanted to ask a follow-up for you, April. So in your presentation, you mentioned a couple times that the halal market owners, store owners in the community were really important in this process. Can you say some more about that? Why were they important? What were they doing? What role did they play?
Yeah, no, there was a lot of emphasis in the focus groups in particular around one of the halal market owners, or even though there's technically two of them, because one of them provided a community space above their shop for community members to gather, primarily men in the community. So, and not only that, but there's a lot of respect from the community for business owners, people who play a larger role within the community, whether it's as a shop owner or even providing an additional meeting space for individuals within the community to connect. As a result of that, having the halal market owners, if we wanted to partner with them to share messages, whether it's up in their store or during some of their community meetings, would be impactful for individuals within the camp community.
And I was just curious too, if if New Mainer businesses that are owned by New Mainers, are they selling certain tobacco products? Did you get a chance to see, to that question, where are people getting tobacco products in these communities? What's the split between those businesses owned by New Mainer communities versus just other stores? I don't know if that was part of your research, but was curious to ask.
Yeah, no, that second question about where people are accessing tobacco products didn't come up in our focus groups, but in regards to whether or not tobacco products are being sold in either of the markets, yeah. So one of the, I think it was Al Naim, I think it showed a picture of it, does have primarily hookah devices that are up, because once again, there was more of an emphasis on hookah within the community. So they do have quite a few up in the shop and right in the front windows.
Gotcha. Emily, did you want?
Yeah, I will say, Matt, too, with Faucia's expertise, she has also said, I think that this presentation should be given to our halal markets, as well, like our Somali-owned businesses in Lewiston downtown. So that's our hope as well, is to get this information out to them.
Awesome.
As there's a need.
Thank you. So we have just a couple minutes left. Any final questions for our speakers? You can put them in the chat. Otherwise, we will wrap up. So I'll give people a chance to enter any final questions. So just a couple things to note. So these are amazing resources. A couple other resources folks might want to check out. There's a new website from Maine Public Health Association around tobacco use across Maine called tobaccotruthmaine.org. Thanks, Becca, for putting it in the chat just now. That has some great stories, personal stories, connections around tobacco use in our state. interesting data, but I think for me, the thing that hits hardest is those personal stories that are featured on the website. The second thing is MPHA just launched a new podcast called Healthy Maine Talks. Again, thank you, Becca, for putting that in the chat. It's relevant for this group because the first episode features Ray Ruby, the executive director of the Maine Cancer Foundation, talking about their work with groups like Healthy Acadia, community-led approach to combating not only tobacco use, but overall cancer in the state of Maine. So encourage folks to check that out as well. And if there's no other questions, then I can wrap this up. And again, thank you so much, April and Emily, for doing this, and everybody for joining. We'll get the recording up on MPHA's YouTube page fairly soon. And yeah, thank you so much.
Yes, thank you.
All right.